Welcome back to Fight Girls Fight. For those of you that are new to this platform, my name is Shamika, and I am a triple negative breast cancer survivor. This was a outpatient procedure. I went into the hospital, went through pre-op. Of course, I could not eat or drink anything after midnight the night before. And if I drank anything, it could only be water, and I can only have that maybe 4 hours prior to the actual surgery. Okay, clear water, nothing in it, no color, no powder packed mixed in, none of that, just clear plain water. I went in for pre-op. I'm comfortable, I'm all gowned down, IV has been placed, medical history has been confirmed that I haven't eaten anything since midnight, confirmed that, I'm still taking medications. When's the last time you took your medications? All the regular pre-op information. He walks in, we talk about the port, he plays around with me a little bit, me and my husband, we're laughing, we're joking, because again, I will say this 1,000 times, sometimes you gotta laugh to keep from crying. Here we go. So the men come in, or the nurses come in with what I call liquid Christmas. Okay, I used to be a surgery scheduler, so this part for me is like rehearsing. So I'm gonna try to slow down so you guys can kind of get an idea of what I experienced. So the nurses came in when it was my turn to come and get me. They had liquid Christmas, which is a medication they give you to kind of calm down nausea. A lot of people get nauseous after surgery, so they'll give you some medication to stop the nausea, as well as other medications that make you feel a little happy. And that's why I call it liquid Christmas. That warm, tingly feeling that you get on Christmas, that's what that feels like for me. Okay, it's a great experience. And then as I'm singing and feeling great, warm, cozy, and totally forget that my driver, who's my husband, is sitting right beside me, they go ahead and begin to unlock the bed and wheel me down the hallway, heading towards the OR. All right. Once I get in the OR, the anesthesiologist is in there, and they always come prior to you going into the OR to have you sign off on some things, ask you about your previous medical history, any previous surgeries you have, or any questions that you have, and they get you to sign your consent. Then any questions you have regarding anesthesia is there. Now, for some people, this is their first surgery. Okay, this is their first. For others, it may maybe be your second or your third, but every surgery experience for me is somewhat similar, but yet different all at the same time, depending on what I'm getting done. Now, the anesthesiologist, let me tell you this, will be there. Okay, I cannot pronounce that word. I never have in the past 25 years, so just bear with me. But they will be there with you the entire time. They do not just knock you out and leave. They literally have their own setup right here by you. All right. Every experience I've had has been the same. They have their screens up that's monitoring your blood pressure, your breathing, everything. All right. They're at the head doing their job. The doctor or the surgeon is doing their job on whatever body part they are working on. All right. So they don't just leave you there. They literally stay with you to monitor your breathing, how much medication they're giving you to put you right at that point where you are completely asleep and you don't feel a thing. Also, time goes by and you won't even notice. I'm telling you the nothing but the truth. But that's what their job is. And they stay with you until it's time to pull the medication back and wake you up and all that other great stuff. So they never leave you. They do not leave you there. They stay with you the entire time. So take a deep breath on that. They monitor you. They're making sure that you're alert and that your breathing and blood pressure is going well. All right. Okay, here we go. Now, the next portion of it is, I'm in the OR. Usually they'll tell you it's going to taste a little like grape soda. And you're like, grape soda? And they're like, yeah. Now, this is for people who have never been put under before. This is not a situation where your head is spinning out of control and you are like really out of it. And then, no. You're literally talking. And what I do is I talk until I stop. because then they know for them, and this is my way of showing them I'm out, right? So I'm talking. Sometimes they'll ask you to count backwards for me, or count to 10 for me, all right? And then as you're counting, they are injecting through your IV. So you're not getting poked again, but they're injecting through your IV the medication that they're going to give you to put you under. And you're just, me, I'm like, this don't taste like no grape soda. What's that taste? And see, you can't put me out. For other people, they're 10, 9, 8, and so forth, if they make it. For other people, it's 1, 2, they're gone, right? And what it feels like being put under is like you're sitting there at night in your bed, comfortable, watching your favorite show. And you're so tired. But the next thing you know, you just go to sleep. You don't even realize you went to sleep. You don't even realize you went to sleep, right? That's what it feels like, all right? And then the procedure happens and you are waking up. Now, I usually wake up to hearing them call my name. Shamika, 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 Shamika. And then take a deep breath. You okay? How you doing? And they're trying to talk to you. Now, prior to that happening, your surgeon usually comes over and tries to talk to you. And I promise you, you will not remember anything. You could have proposed, sung 3 songs, said a poem. You would not remember anything that you did as you're coming to. Your surgeon come over and they're like, how you doing? And da-da-da-da. And da-da. I usually tell patients, just go back to sleep. Because you're not going to remember anything that you say or what they say either. But usually they go out and they talk to your driver or the people that are with you and let them know surgery went well, you know, medication has been prescribed, is sitting at the pharmacy, whatever the case may be. But afterwards, this is things that my hospital gave me of what to expect after the procedure. So you're going to expect some discomfort at the port insertion site. This is everyone. You're going to expect a little discomfort. There's a foreign object being put in your body, being ran through and all the way over through. Okay. You're going to feel some discomfort, okay? Bruising on the skin over the port is common. I did not have bruising, but some of you will, and this should improve over 3 to 4 days. After the port is placed, you will get the manufacturer's card, which I received, and I put that in my wallet. The card has information about your port. Keep this with you at all times. Reason being is if you fly, you're going to go through metal detectors in some places, airports, things of that nature, and you have to show them why it's beeping and going off, right? I don't have a weapon. I have a port. Here's my port. But pull out that card. Boom. Here you go. This is why this is beeping or whatever the case may be, you know. And then, of course, they're going to do the thing on you, you know, and you're just like, I have a port. Here's my card. Okay. And that's the purpose of carrying that card in your wallet wherever you go. Okay. It says to take care of your port as told by your healthcare provider. Ask your healthcare provider if you or your family member can get training for taking care of the port at home. A home healthcare nurse may also take care of the port for you as well, if they can get, you know, things like that. Make sure to remember what type of port you have. There's different types of ports. I had the power port. Again, some people had issues with it. I did not have any issues with my power port at all. It never clogged up on me. It worked really well. They did not have any problems accessing it, and I'm going to explain that to you in the moment. As far as your incision care, because what I just read to you was port care. This is the incision care. Follow your instructions that your healthcare provider provided for you to care for your incision site. Make sure you leave the skid glue in place. There's skid glue that they put across. It looks a little like a clear glue. Just do not pull it off. Do not pull it off. I can't stress that enough. And there's also going to be skin glue. My skin glue was across the incision, and it also was across this part right here. It's going to tell you to leave the skin glue in place. These skin closures may need to stay in place for 2 weeks or longer. Okay, so this skin glue is waterproof, all right, but just make sure you pat dry versus rubbing it. Plus, you're not going to want to do that anyway, because you can definitely feel that your port is there. Some people forget that it's there. I did not forget because it was there, right? So you know that it's there. It sticks out. And it also says, check your port insertion site every day for any signs of infection. And they give you the signs of infection, which is redness, swelling or pain, fluid or blood, okay, warmth to the touch, pus, or bad smell. And we're talking about the incision site, okay? That is where you are going to see those things happen if it's infected. Mine did not get infected. As far as activity level, they're going to tell you to return to your normal activities as told by your healthcare provider. Ask your healthcare provider what activities are safe for you to do. Do not take baths. Do not swim or use a hot tub until your healthcare provider approves it. Because mind you, y'all, this is a deep incision, all right, to put this port in, all right? And you want to keep it as healthy as possible. And I said healthy for a reason, okay? It says, ask your provider if you may take showers. You may only be allowed to take sponge baths, actually. So you need to ask. Do not drive after this surgery for 24 hours if you were given a sedative during your procedure, which you're going to be given, okay? I am an OR girl. I'm just going to be honest. I didn't care what my insurance liked or not, okay? I'm going to the OR. All right, I've been through enough in my life. You're not going to have me awake and just going to sedate to put the port in or to take it out. Let's be very clear. We're going to talk about the removal of the port. I play no games. Knock me out, please, Alex, for 200. All right. You are not going to have me awake doing any procedure that's that invasive. All right. Why? People are like, but my insurance only covers, and I'm not trying to be mean or anything like that. But listen, y'all. Do yourself a favor. Go to sleep. Be put to sleep so you can get this stuff put in so you can do what you have to do. That's just my suggestion. But if you care and you're like, no, I've had patients when I was trying to schedule surgery for them, before say, I don't think I need anesthesia. Yes, you do. You do need anesthesia. You do. Please. And I would laugh, not at them, but just like, girl, yes, you do. Yes, you do. Yes, you do. If I'm taking you to the OR, you need anesthesia, because they were so worried about their health care. And we give the appropriate diagnosis codes when we're getting your prior authorization for surgery. We are given the right diagnosis codes. Now, keep in mind, ladies and gentlemen, anytime you're getting any form of surgery dealing with cancer, your insurance company will pay for it. Cancer is the key word. Malignancy is the key word to get a yes for that. It's very rare they will deny. I have never seen them deny anything for cancer, and I've been doing this for 20-something years, okay? I've never, because they know, listen, right? They're not going to say, oh, no, you can't have that. Now, unless it's something experimental, that's when they may get a little... But if it's like surgery and things like that, regular treatment, they will not deny. Okay, so don't worry about that part. Just be kind to yourself. Give yourself grace. All right, so please don't get offended because I said, girl, yes, you do. Yes, you do. Okay, treat yourself. Come on now. We gotta. Okay, ladies, we can do this. All right. So it tells you to not drive for 24 hours. Wear a medical alert bracelet in case of an emergency. This will tell the healthcare providers that you have a port. That's why I keep the card in, because they typically kind of look in your wallet sometimes. But, I have a port. I have a port. I have a port. Keep all follow-up visits just told by your healthcare provider. Do not flush your port with saline or direct. Don't do anything with your port, okay? If there's any other doctors that you have, if you make visits to the emergency room, a lot of times those nurses, you can say, hey, it's easy. Look, whatever you need to give me, give it to my port. Let me tell y'all, I've been in the ER so much, they will not touch your port. Unless you got somebody that is super duper comfortable with accessing a port, they will not touch your port. I'm going to show you what this book has of how your port is to be accessible, okay? They're going to give you numbing equipment. They're going to give you equipment, sorry. They're going to give you numbing medication, you guys, to numb your port prior to your chemo. So you don't have to worry. What you do is, I have pictures that I'm going to attach. Or if you look through this page, you will see my pictures of me putting cream. That's what I'm doing. It's this cream that you put on your port, right on your port. So in the middle of your port, there's 3 little dots, and you could see it through mine, but some people you can, okay? That gives the nurses a place for them to aim in the middle of that. But the first thing they're gonna do is feel your port. They're going to feel where your port is, all right? Tell them to be a little gentle, because sometimes they can be a little, they don't realize they're being, you know, it's a little sensitive, but just let them know, like, hey, make a, that hurt, and they'll kind of be, less, Then this is usually what the needle looks like. It looks more like a circle with like this needle that sticks out, that goes directly into your port, but it has like a little curve at the base of it a little bit. But that's what they're gonna do. So what you do with your numbing cream, and I'm gonna go over this with you in the video regarding your first day of chemo, okay? You're gonna put the numbing cream on with the cream. Don't put it on your fingers, y'all. Take a piece of plastic, like some cellophane or something like that, plastic wrap, cut it and put it right on top, and go ahead and get yourself dressed, okay? Make sure it's in place, but that's in place to keep your clothes from removing the numbing cream from that area, all right? Leave it on. I left mine the first day, y'all, I left it on from the moment I put it on to the moment I walked in, okay? The chemotherapy tech, she had to wipe it off. And my chemotherapy techs were amazing. She had to wipe it off. She's like, you ain't playing. I need that thing to be numb, because I didn't know what it was going to feel like, right? So you just want to make sure that you definitely have that prescription and you get that prescribed prior to chemo. This packet also informs you of if you get sick and things like that after. Just kind of give them a call. And also to take some Tylenol afterwards for pain, because it's more of an outpatient surgery. They really do not prescribe you anything that is really hard type of opioids or anything like that for this procedure. So ibuprofen or Tylenol, they'll tell you to take. And other than that, you guys got this. Now, for those of us who are going through this portion of the journey, keep in mind that this is just a short thing right here. And this is meeting with your general surgeon or your reconstructive surgeon to go over the procedure as far as your port being placed. Some of you all will get your port placed and do chemo the very next day. Let's be clear. That's sometimes how fast it is. Some people, they get their port placed, and as soon as they get out of surgery, the very next morning they're doing chemo. Okay, because it's just really placing the device so that you are able to get chemo without destroying your veins, because chemo will destroy your veins. Also, I also want to add to this, whenever it comes down to when we're discussing getting your port put in and things of that nature, what you also want to remember is to go online and purchase one thing. One moment. These are seatbelt pads that I purchased on Amazon. Just look for port seatbelt covers. These, you actually put these on your seatbelt. It's a Velcro. This is old, you guys. But you put your seatbelt in your car. I had it on both sides because sometimes I drive and sometimes I ride, right? And you put your seatbelt in the middle and you just Velcro that thing on. And it protects. Then this is how it's going to sit across you. It protects your port. It protects you from pain with the seatbelt strapped across your chest, okay? Because you're going to really realize like how tender, even after surgery, even months after surgery. For me, it was very tender. Still, I could feel it there. So for me, it was like, it's really there, So I had this, but this is how it's going to sit. Your seatbelt's going to be in between, wrapped around you, but this protects you from pain with your seatbelt being so tightly against your port. And again, I purchased 2 of these, and they say different things. Life isn't about waiting for the storm to pass. It's about learning to dance in the rain. And I'm not sure this one says the same thing. Nope. Sometimes you forget you're awesome. So this is your reminder. So like I said, you can purchase these on Amazon. I don't remember how much they costed, but they weren't a lot at all. I'm being serious. I want to say they were less than $20, less than $25. And I think I don't even think they were that much. But yeah, this is a great thing that you can use or now, if you don't want to purchase these on Amazon, you could just take a small pillow and stick it right there and make sure your seatbelt's over it. You know, put some tape right there against the pillow and the seatbelt. Boom, you got one of these. But for those of us that want to go on Amazon and grab these, and they come in different designs with different sayings to encourage you and motivate you as well, because that's what these are used for. All right. So we're going to go ahead and move on with it, you guys. Keep up the fight. Stay positive, stay encouraged, stay empowered. And if you have any questions, make sure you send them to me, and I most definitely will respond. Have a blessed day, you guys, and fight, girls, fight.